Today, we're going to be talking about one of the most common complaints in the medical field. Everyone who's watching this, even you right now, you've most probably complained about this at least once in your life. And almost everyone I know has had this problem at least once in their life. And the problem is diarrhea. And that's what we're going to be taking a look at. We're going to be learning everything from what is diarrhea, what causes diarrhea, what are the symptoms of diarrhea, and what are the warning signs of diarrhea. That means what you have to watch out for when you're having diarrhea. So what is diarrhea? How do we define diarrhea? In Malay, we call it as cirit birit. So diarrhea basically means your body's solid waste is now more watery, more liquid, and it's being secreted more frequently in a day. Now, diarrhea is a serious thing because it can range from being very mild and temporary and can go all the way up to being super serious to the point where it's life threatening. And each year there are about 2 billion cases of diarrhea and 1.9 million children die of diarrhea. Most of these children are under 5 years old and most of them are in developing countries. And 1.9 million children die every year because of diarrhea. Now, there are a lot of causes of diarrhea. It can be viral, it can be bacterial, but most of the time, it's because of contaminated food. So certain viruses like norovirus, rotavirus, certain bacteria like Campylobacter, E. coli, all these can cause diarrhea. But then in some cases, even parasites can infect you and can cause diarrhea. And this is mostly because of contaminated water. And most people have this complaint when they are traveling, when they're going abroad. It's either after they come back from their traveling or like during their travel period itself. And this is most of the time because the country they're traveling to, the place they're traveling to, is not hygienically good. It's not very clean. So in this case, we call this a traveler's diarrhea. And a person can also have diarrhea if they are too anxious, when they're stressed, when they are hit by anxiety, if they have some sort of food allergy, if they eat that food, they'll start getting diarrhea. Some medications can give you diarrhea. And certain chronic conditions like irritable bowel syndrome will give you diarrhea. So it's not always just food related. So what are the symptoms of diarrhea? When will you say that you are having diarrhea? Well, first and foremost, like the main symptom is loose stool. That means having watery stool. And most of the time, this is 3 or more times in a day. That means more than 3 times watery stool. That's when you call it diarrhea. And then some of us might even have the urgency, the sense of urgency to like, okay, I have to go and sit on the toilet bowl now, but then nothing is happening. Like I'm not defecating, but I just have to go sit there like that. And then we also have abdominal pain, abdominal cramping, change in the color of your stool. Sometimes the stool can be mixed with mucus, pus, blood, or even fat. Most of us will have vomiting, general weakness, feel very tired, and feel very dehydrated. One of the main complication of diarrhea, like the main problem people think of whenever you say diarrhea, is dehydration, because your body is right now losing too much water, especially if you're not drinking enough water. The amount of fluid you're losing through diarrhea itself can kill you. And this is the main thing we watch out for. This is what we call as the warning sign. So whenever someone comes in with a complaint of diarrhea, the first thing we look for is how dehydrated this person is. So there are certain signs and symptoms we look for to see whether a person is dehydrated or not. The first sign is they look very tired. They got no energy at all, no appetite to eat, feel very nauseous, feel very lightheaded, feel very dizzy, have a dry, coated tongue, have sunken eyes, the heart rate is very fast, and they might even be having muscle cramps. If you see any of these symptoms on top of other signs of dehydration, like the skin is literally dry, or the pinch test, when you pinch the skin takes forever to go back to normal, these are all warning signs. That means this person is severely dehydrated and they need IV drip in them right now. And diarrhea, usually it resolves by itself. Like even if you go to the hospital, even if your kid has diarrhea, if it's mild to moderate diarrhea, usually they'll just give supportive therapy, and most of the time your body will know how to heal itself. But then in certain cases, when the dehydration is very severe, that's when we need to administer IV fluids. That means we have to fill your body up with fluid because you're losing too much water. And that's everything you need to know about diarrhea. What diarrhea is, what causes diarrhea, what are the symptoms of diarrhea, and also what are the warning signs of diarrhea. If you found this video to be valuable, if you learned anything at all from this video, please do share this video with your friends and family members, spread the knowledge. If you haven't subscribed to our channel yet, go ahead and smash that subscribe button right there, and please do click the bell icon because YouTube's algorithm is changing all the time and we want to make sure our videos come and reach you. And until the next informative video in anything you do, please do your best and be the best version of yourself. Bye-bye.